Subcommittee on Workforce Protections will come to order. Welcome, everyone. I note that a quorum is present. The subcommittee is meeting today to hear testimony on clearing the air, science-based strategies to protect workers from COVID-19 infections. I note for the subcommittee that Mr. Courtney of Connecticut is permitted to participate in today's hearing with the understanding that his questions will come only after all members of the subcommittee on both sides of the aisle who are present have had an opportunity to question the witnesses. This is an entirely remote hearing. All microphones will be kept muted as a general rule to avoid unnecessary background noise. Members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek recognition. I also ask that members please identify themselves before they speak. Members should keep their cameras on while in the proceeding. Members shall be considered present in the proceeding when they are visible on camera, and they shall be considered not present when they are not visible on camera. The only exception to this is if they are experiencing technical difficulty and inform committee staff of such difficulty. If any member experiences technical difficulties during the hearing, you should stay connected on the platform, make sure you are muted, and use your phone to immediately call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away to vote on the floor, Mr. Scott of Virginia, as a member of this subcommittee, or another majority member of the subcommittee, if he's not available, is hereby authorized to assume the gavel in the chair's absence. This is an entirely remote meeting, and as such, the committee's hearing room is officially closed. Members who choose to sit with their individual devices in the hearing room must wear headphones to avoid feedback, echoes, and distortion resulting from more than one person on the software platform sitting in the same room. Members are also expected to adhere to social distancing and safe health care guidelines, including the use of masks, hand sanitizer, and wiping down their areas, both before and after their presence in the hearing room. In order to ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's field timer. The field timer will appear on its own thumbnail picture and will be named 0001 timer. There will be no 1 minute remaining warning. The field timer will sound its audio alarm when time is up. Members and witnesses are asked to wrap up promptly when their time has expired. And while a roll call is not necessary to establish a quorum in official proceedings conducted remotely or with remote participation, the committee has made it a practice whenever there is an official proceeding with remote participation for the clerk to call the roll to help make clear who is present at the start of the proceeding. Members should say their name before announcing they are present. This helps the clerk and also helps those watching the platform and the live stream who may experience a few seconds delay. At this time, I ask the clerk to please call the roll.
Chairwoman Adams.
Present.
Mr. Takano.
Present.
Mr. Norcross.
Present.
Ms. Jayapal.
Present.
Ms. Omar.
Present.
Ms. Stevens. Mr. Jones.
Present.
Mr. Yarmouth.
Present.
Mr. Scott. Mr. Keller.
Present.
Ms. Stefanik, sorry.
Present.
Mrs. Miller Meeks. Mr. Owens. Mr. Good.
Present.
Mr. Cawthorn.
Present.
Mrs. Steele. Chairwoman Adams, that concludes the roll call.
Thank you for that. Pursuant to Committee Rule 8C, opening statements are limited to the chair and the ranking member. This allows us to hear from our witnesses sooner and provides all members with adequate time to ask their questions. I recognize myself now for the purpose of making an opening statement. I want to welcome everyone to the first hearing of the Workforce Protection Subcommittee in the 117th Congress. Today, we will discuss the imperative to protect workers' health and safety. The COVID-19 pandemic has posed one of the most significant threats to workers' health and safety in a century. Across the country, tens of thousands of workers have been infected by COVID-19 on the job, and many thousands have died. Meatpacking workers, healthcare workers, transportation workers, correctional workers, and other frontline workers are all struggling with the severe physical and emotional trauma of the pandemic. And while some of us have the luxury of working from home, these workers who are disproportionately low income and people of color are risking their lives to keep our communities afloat. And one of our witnesses today, Pascaline Muhandira, is a nurse at the hospital in Kansas City. Her co-worker, Celia Yap Banago, died of COVID-19 due to unsafe working conditions. Ms. Yap Banago's family is watching today's hearing. I want to express our condolences for your loss and appreciation for the critical work for which Ms. Yap Banago gave her life. These tragic losses are even more heartbreaking, considering that until recently, the Occupational Safety and Health Administration, or OSHA, was missing in action and opportunities to save lives were lost. Under the Trump administration, the federal agency charged with protecting workers refused to issue new enforceable safety standards, leaving workers vulnerable to workplace infections. The agency made it harder to keep track of workplace illnesses and industries. The political appointees at OSHA failed to leverage the agency's resources to adequately inspect work sites and allowed multi-billion-dollar corporations to get off with meager penalties while ignoring worker deaths that were likely linked to COVID-19. And during a hearing last year, OSHA's acting assistant secretary even refused to acknowledge that COVID-19 possesses or poses a grave danger for workers. OSHA's inspectors and staff have worked hard to keep workplaces safe, given the resources they have. But the Trump administration's political leadership abandoned OSHA's mission and left workers with little to no help from their government. As a recent report from the Department of Labor's Inspector General found, worker complaints have skyrocketed during the pandemic, but OSHA inspections have fallen dramatically over the past year. The report also called on OSHA to consider issuing an emergency temporary standard. A recent Wall Street Journal investigation revealed a litany of major workplace COVID outbreaks, OSHA complaints, and insufficient responses from federal OSHA or state OSHA plans. The main argument for inaction: federal OSHA had no COVID-related standards. The journal identified more than 1,000 worker deaths from COVID-19 that were likely linked to workplace transmission of the virus, but had never been investigated by OSHA. Employers had failed to report many of these fatalities to OSHA. So today, our witnesses will help us assess how the Biden administration can recover from these failures and keep workers safe and healthy moving forward. First, OSHA must swiftly issue a strong emergency temporary standard, or ETS, to protect workers against COVID-19 infections. For more than a year, Chairman Scott and I urged the previous administration to issue an ETS, but OSHA refused. Thankfully, the Biden administration has moved quickly to restore OSHA's purpose by directing OSHA to consider issuing an ETS. And I'm hopeful that we will see this ETS soon, but we must do far more to protect workers. And as our witnesses will share, we must better protect workers from the airborne transmission of COVID-19. We now know the virus spreads not just through large droplets that quickly dissipate, but through microscopic particles that can travel long distances and for long periods. This has major implications for protecting workers who are frequently in close contact with others. Yet, the Centers for Disease Control and Prevention has not updated its workplace guidance to reflect this clear scientific evidence, which is essential to shape a strong OSHA standard. We also need a plan to get vaccines to all of the essential workers who have risked their lives to keep our economy going. Americans across the country are thankfully starting to get vaccinated, but we still have no national strategy to ensure that in addition to emergency responders and healthcare workers, grocery store clerks, meat processing workers, teachers, transportation workers, corrections officers, and others are not left behind. We must also take clear steps to track workplace COVID-19 infections. Shockingly, the federal government has no system for monitoring the number of workers who've gotten sick or where they are employed. The previous administration effectively gutted requirements for employers to report COVID-19 related worker hospitalizations. And so we cannot hope to learn from the lessons of this pandemic without the data to understand how to protect workers in the future. Any discussion about protecting healthcare workers must also address the disproportionately high rates of violence that healthcare and social service workers face on the job. Today, we will discuss legislation introduced by Representative Courtney that requires OSHA to promptly issue a workplace violence prevention standard to protect healthcare and social service workers. Finally, in order for OSHA to identify and address the most dangerous workplaces, it must be able to collect accurate injury and illness data. Today, our witnesses will also discuss legislation introduced by Representative Takano that would allow OSHA to more effectively enforce its injury and illness record-keeping requirements. National emergencies such as this pandemic are the exact reason why OSHA was first established. Yet for far, far too long, OSHA's leadership was asleep at the wheel, costing the lives of workers. Now we have the opportunity to restore OSHA's mission and protect workers' health and safety at a time when they need it most. Today's hearing is an important first step towards that goal. I'd now like to recognize the distinguished ranking member for the purpose of making an opening statement.
Thank you, Madam Chair. I'm disappointed that today's hearing is being held in a completely virtual format. As I can show you at today's Washington Post, the people working in the House chamber show up every day and do their jobs. And I think we should be here in our committee's hearing room. I'm currently in the committee hearing room, and it can comfortably accommodate the 16 members of this subcommittee. This hearing should be in person so that we can participate and do this work safely. After all, the subject of today's hearing is science-based strategies to protect workers, and members of the subcommittee should have the opportunity to set a positive example by conducting this hearing in person while adhering to the most current workplace safety guidelines. Over the last year, the pandemic has created unprecedented challenges for all Americans, especially workers and job creators. The top priority for employers throughout this crisis has been and will continue to be preventing the spread of COVID-19 in the workplace to ensure the health and safety of workers and customers. Thankfully, a year to the date after the World Health Organization declared COVID-19 a pandemic, America now is equipped with much greater and thorough scientific knowledge of the virus, and innovative employers have developed effective procedures and policies to keep workplaces as safe as possible. Over the past year, business owners have worked around the clock to operate safely under evolving state and local mandates, CDC and OSHA guidelines, and industry recognized best practices to protect their workers. The vast majority of businesses, regardless of size and location, have invested significant resources to implement comprehensive and effective safety precautions specific to their workplaces. And now, thanks to the successful efforts of Operation Warp Speed, essential workers have been prioritized for vaccination. And President Biden has stated that the US should have enough vaccine doses for every eligible adult in the United States by the end of May. We are not out of the woods yet, but America is on the path to recovery, both in terms of health of our citizens and our economy. Under the Trump administration, the federal government collaborated with businesses across the country, updating them as new information arose on the newest guidelines and procedures to keep workers and customers safe. This dialogue allowed businesses the flexibility to create health and safety plans that fit their specific workplace, creating an efficient path forward for businesses. My Democrat colleagues have said almost from day one of this pandemic that it is necessary for Osha to issue an emergency temporary standard, or ETS, a rigid, one-size-fits-all regulation specific to COVID-19 that would apply to every workplace throughout the country. Not one ETS has been issued since 1983 because of legal challenges and lack of due process for affected stakeholders. In 2021, an ETS will do far more harm than good for workers, employers, and the American economy by denying businesses the opportunity to respond quickly to new scientific findings and industry-specific needs. Not all workplaces are the same, yet Democrats are eager to impose rigid and inflexible mandates on businesses. This inflexible, lagging method to keep workers safe will only hinder our economy recovery and make it more difficult for employers to ensure safety in their respective workplaces. If OSHA had enacted an ETS a year ago, as committee Democrats demanded it, it would be woefully inadequate in protecting workers today. Issuing an ETS is not a science-based approach and is instead yet another example of overbearing government policy that will do nothing but constrict employers from safely running their businesses. 4 states across the country have adopted statewide emergency temporary COVID-19 regulations. In California, we're already seeing its negative effects. Since issued in November, the regulations have conflicted at various points with CDC guidance for workplaces, causing massive confusion for employees and their employers. Additionally, the California emergency rule places many new significant burdens on employers and job creators related to workplace testing, paid leave, and required reporting to public health authorities. This is no way to help an already suffering economy. More mandates from Washington, including an OSHA ETS, would not only add burdensome regulations on employers that stifle creativity and ultimately hold them back. Instead, the federal government should be focusing on ensuring adequate vaccine supply and distribution to vaccinate all workers and providing timely public health guidance to our employers as this nation works toward economic prosperity. I'd like to thank all of our witnesses for joining us today, and I look forward to hearing your testimony. Thank you, and I yield back.
Thank you. Thank you to the ranking member. Without objection, all of the members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word by 5 p.m. March 25th, 2021. I'd now like to introduce our witnesses. Our first witness will be Dr. Lindsay Marr. Dr. Marr is the Charles P. Lunsford Professor of Civil and Environmental Engineering at Virginia Tech. She's one of a small number of researchers in the world who study viruses in the air. She holds a BS in engineering science from Harvard and a PhD in civil and environmental engineering from UC Berkeley, and she completed her postdoctoral training at MIT. Our next witness will be Ms. Pascaline Muhindura. Ms. Muhindura is a registered nurse in Kansas City, Missouri. She works in a critical care unit. And since March 2020, she's been caring for COVID patients. She's a member of the National Nurses United and serves as a nurse representative and a member of the Professional Practice Committee for her union. Following Ms. Muhindura will be Mr. Manes Rath. Mr. Rath is a partner with Keller and Heckman in Washington, D.C. He represents employers in a wide range of matters related to occupational safety and health, law, litigation, wage and hour, and class action litigation and association law. Our final witness will be Dr. David Michaels. Dr. Michaels is an epidemiologist and professor of environmental and occupational health at George Washington University. He serves as Assistant Secretary of Labor for the Occupational Safety and Health Administration from 2009 to 2017, and he was a member of the Biden-Harris Transition COVID-19 Advisory Board. To our witnesses, we appreciate you for participating today. We look forward to your testimony. Let me remind you that we've read your written statements and they will appear in full in the hearing record. Pursuant to Committee Rule 8D and the committee practice, each of you is asked to limit your oral presentation to a 5-minute summary of your written statement. I also want to remind the witnesses that pursuant to Title 18 of the U.S. Code of Section 1001, it is illegal to knowingly and willfully falsify any statement, representation, writing, document, or material fact presented to Congress or otherwise conceal or cover up a material fact. So before you begin your testimony, please remember to unmute your microphone. During your testimony, staff will be keeping track of time and a timer will sound when time is up. Please be attentive to the time, wrap up when your time is over, and remute your microphone. If you experience technical difficulties during your testimony or later in the hearing, you should stay connected on the platform and make sure you are muted. Use your phone to immediately call the committee's IT director, whose number was provided in advance. So we will let the witnesses make their presentations before we move to member questions. When answering a question, please remember to unmute your microphone. I want to recognize first Dr. Lindsay Marr. Dr. Marr?
Thank you. Chairwoman Adams, Ranking Member Keller, and members of the subcommittee. My name is Lindsay Marr, and I am a professor of civil and environmental engineering at Virginia Tech. I have studied airborne transmission of viruses for the past 12 years and have published more than 30 scientific papers on the topic. I co-authored the recent letter to the Biden administration and the CDC calling for immediate action to address inhalation exposure of SARS-CoV-2 to prevent COVID-19 infections and deaths. Today, I will address 4 major points. 1, how COVID-19 is transmitted mainly by breathing in aerosol particles carrying the virus. 2, how best to protect workers and the public through the use of appropriate face coverings and other controls. 3, what updates are needed to CDC's guidance. And 4, what needs to be done to protect workers and the public from becoming infected. There are 3 possible ways for the virus to be transmitted. You could touch an object that has been contaminated with the virus and transfer it to your eyes, nose, or mouth. Or you could be hit by large respiratory droplets that fly out of a sick person's mouth and land directly in your eyes, nose, or mouth. Or finally, you could breathe in small aerosol particles from the air that float around for an extended period of time like cigarette smoke. There is now overwhelming evidence that inhalation of tiny virus-containing aerosols is the main route of transmission for COVID-19. When people breathe, talk, sing, laugh, cough, or sneeze, they release far more aerosols than large droplets, as shown in this diagram. These aerosols, shown in red, are most concentrated close to the sick person, and they don't fall quickly to the ground like the large droplets, which are shown in blue. The aerosols remain floating in the air and follow air currents for more than 6 feet, like cigarette smoke, filling a room and building up over time if the space does not have good ventilation, as also shown in the diagram. When people are talking in close proximity, it is much more likely that they will breathe in each other's respiratory aerosols than shower each other with large droplets of spittle. Workers require special consideration because they may spend 8 to 12 hours in a poorly ventilated environment where they cannot avoid sharing the air with other people, much longer than a customer who briefly passes through the space. If ventilation is inadequate or workers do not wear a good mask or respirator, they could breathe in enough viruses from the air to become sick with COVID-19. The most effective way to protect workers is to control the source of infection. Unfortunately, workers may be exposed to members of the public who are unmasked, especially in restaurants and some businesses. The next priority is to use engineering controls, such as ventilation, to dilute the virus in the air. Respirators and masks are considered the final line of defense. Because SARS-CoV-2 is transmitted mainly by aerosols, the appropriate PPE for workers at elevated risk is a high-performance mask or a respirator. Unfortunately, most CDC guidance has not yet been updated or strengthened to address and limit inhalation exposure to aerosols. To use a technical term, it is as clear as mud. Their web pages downplay aerosols and airborne transmission, a position that is exactly opposite the best scientific evidence. Their guidance continues to put workers and the public at serious risk of infection and undermines the effectiveness of an Osha standard. I co-authored a letter calling for CDC to update and strengthen its guidelines to fully address transmission via inhalation of aerosols at both close distances and farther away. We also urge Osha to issue an emergency standard on COVID-19 that requires implementation of control measures, including ventilation and respiratory protection against aerosols for all healthcare workers and other workers at high risk, including those in meatpacking, corrections, and public transit. It is clear from the evidence and our experience over the last year that only strong CDC guidance and OSHA standards that are based on the best available science will enable us to safely reopen workplaces and schools while ending this pandemic and better preparing us for the next one. Thank you.
Thank you very much, Dr. Marr. We'll now hear from Ms. Pascaline Muhindura. You're recognized, ma'am.
Good morning, and thank you, Chairwoman Adams, Ranking Member Keller, and members of the subcommittee for giving me the opportunity to testify today. I'm a critical care nurse at Research Medical Center, an HCA healthcare facility in Kansas City, Missouri, and I'm a proud union member of National Nurses United. I will make three main points today. First, my employer has failed to protect us. Second, the CDC and OSHA have failed to protect us. And third, the CDC and OSHA must take immediate steps to ensure that nurses and other workers get the protections we need. For more than a year, I have been caring for patients in a COVID unit in my hospital. Every single nurse and healthcare worker in my unit has contracted COVID because we're not given the protections we need. My colleague Celia lost her life. As Dr. Marr outlined, SARS-CoV-2 is transmitted through the inhalation of aerosol particles. That means that nurses and other frontline workers must be given respiratory protection. At minimum, we need N95 respirators, which are only safe for single use. Power-aired purifying respirators and elastomeric respirators are more protective and are safely reusable. In January 2020, nurses urged our employer to prepare for COVID. They didn't. When the pandemic started in March, none of the COVID nurses had been fit tested for N95s. Management had not implemented our recommendations from January. On March 21st, management collected all of the PPE in the hospital, locked it up, and began rationing N95s. The next day, a patient was transferred from the emergency department to the cardiac telemetry unit. The nurses on the unit recognized the patient had signs of COVID, and they asked management for N95s. Management refused. The patient later tested positive, and as a result of her exposure to this patient, my colleague Celia Yat-Banago contracted COVID and lost her life. Despite Celia's death, the hospital continues to ration N95s. Management is still forcing us to unsafely reuse the same N95 for our entire shift and is recommending that we use surgical masks with COVID patients. To be clear, Nurses on my unit are still caring for COVID patients without adequate protection. This isn't just happening in my hospital. In NNU's February 2021 survey of nurses across the country, more than 81% report that they still have to reuse at least one type of single-use PPE. As union nurses, my colleagues and I have been fighting these dangerous policies every step of the way. As registered nurses, we know that as long as our safety is compromised, our patients are also at risk. In all of our conversations with management, they have told us the same thing. They're following CDC guidelines. The CDC guidelines are not based on science. To this day, the CDC does not recognize aerosol transmission of COVID. The guidelines allow healthcare employers to give nurses surgical masks instead of respirators and to reuse N95s. Management withholds PPE and they use CDC guidelines as their justification for putting our lives at risk. My union filed a complaint with Osha last spring about the circumstances that led to Celia's death. Osha found clear evidence that Celia and other nurses had been exposed to COVID because of our employer's failure to provide PPE. But Osha could not cite my employer because the CDC guidelines are weak and because Osha doesn't have a standard on infectious disease. As union nurses, with our practice rooted in science, we have clear recommendations for what we need to be able to care for our patients safely. First, we need the CDC to update its COVID guidelines to be based on scientific evidence, especially regarding aerosol transmission. The CDC needs to revoke the crisis standard on optimization of PPE, which are based on supply consideration, not science. Second, we need a federal OSHA standard that requires our employers to protect our health and safety at work. If these recommendations had been implemented 1 year ago, my colleague Celia, along with thousands of other healthcare workers, would be alive today. We need immediate action so that nurses and our patients get the protections we need.
Thank you very much. I want to, okay, we need to make sure we mute, please. Okay, thank you. I'm going to go vote now on the floor, and Mr. Scott, would you please assume the gavel?
I will, thank you. Our next witness is Mr. Rath.
Thank you very much. Good morning, Chair Adams, Mr. Scott, Ranking Member Keller, and members of this subcommittee. I'm grateful for the opportunity to speak before this subcommittee on this issue today, clearing the air, science-based strategies to protect workers from COVID-19 infections. I am Manish Rath. I'm a partner at the law firm Keller and Heckman LLP here in Washington, D.C. I work with employers to develop effective improvements in workplace safety and health. It is my testimony today. In my testimony today, I'm expressing only my own understanding of and experience in the fields of occupational safety and health law and administrative law, and I'm not here as a representative of any other entity. Today, I will address some of the efforts that I have seen employers undertake in response to COVID-19 during the pandemic this past year, and some of the conclusions that employers have drawn from their experiences. During this pandemic, employers with whom I have worked have engaged in a continuous cycle of evaluation and improvement as scientific and healthcare understanding about COVID-19 has evolved. Employers have implemented fundamental interventions, and some simple interventions have endured because they work. For example, universal use of face masks, hand washing, disinfecting frequently touched surfaces, and distancing where achievable, and installation of temporary barriers where distancing is not achievable. We have also seen creative solutions that only the private sector could have developed and could not have emanated from government. For example, employers have deployed private transportation networks for workers to isolate them from public transportation exposures. One manufacturer with whom we've worked fabricated cooling booths, equipping those booths with air conditioning to allow manufacturing workers to take periodic maskless heat stress breaks. We've seen employers deploy temporary portable adjunct space for additional meeting and break rooms. Several employers we've worked with have increased their janitorial staff substantially. A couple of employers I've worked with have even engaged their own epidemiologists in order to respond more rapidly than could be seen from OSHA or the Centers for Disease Control and Prevention to adapt to changing science about COVID-19. In addition, we've seen employers that have willingly tried interventions that have had diminishing value. For example, employers early in the pandemic quarantined inventory for 24 hours if the inventory may have been exposed to positive workers, positive cases. We now see that that's been used less and less frequently, and even the CDC has recently opined in October of 2020 that contaminated surfaces comprise an uncommon transmission vector. In another example, every employer I've worked with implements symptom screening and temperature check at the beginning of every shift for every employer, for every employee. And yet we now see evolving science demonstrate that asymptomatic and pre-symptomatic cases comprise the significant fraction of transmission spread. The many changes we've seen in the CDC have also taught us the importance of a flexible guidance-based approach to COVID-19 in the workplace. For example, on April 6th, 2020, the CDC recommended avoiding all non-essential travel, even intra-city. Within 48 hours, the CDC revoked that guidance and again updated it in February 2021. We've seen in February 10th, 2021, the CDC released an updated mask recommendation recommending both a disposable mask and, on top of that, a cloth mask. So even a year after the onset of the pandemic, the CDC's guidance has been updated on something as simple as masks based on data-driven science. If OSHA had implemented any of these recommendations in an emergency temporary standard a year ago, those requirements would have been quickly antiquated by science, dismissed by the public, and a discredit to the agency. In its wisdom, OSHA chose instead to issue guidance documents, and indeed, in a 1-month period, issued 13 guidance documents, some of which were industry specific, all of which could be rapidly revised to meet the changing conditions and science of the pandemic. As with the examples I've discussed, employers have already demonstrated the ability to quickly adapt and implement new interventions faster than government can develop policy. For the same reason, agency guidance that can be rapidly updated is better suited to our evolving understanding of COVID-19 than emergency regulations could be. Thank you for the opportunity to appear before you, and I look forward to addressing any questions you may have.
Thank you. Dr. Michaels.
Thank you, Chairman Scott, Ranking Member Fox, Ranking Member Keller, members of the subcommittee for inviting me to testify today. My name is David Michaels. I'm an epidemiologist and professor at the Milken Institute School of Public Health at the George Washington University. From 2009 to January 2017, I served as Assistant Secretary of Labor for the Occupational Safety and Health Administration, OSHA. I was also a member of the Biden-Harris Transition COVID-19 Advisory Board. Workers are at the core of this pandemic. Millions work 8 or more hours a day in close proximity to coworkers or members of the public in poorly ventilated settings with inadequate protection, performing the activities necessary to maintain the economy and social functioning. They can't avoid exposure to the virus, which has sickened or killed an enormously large number of them. These workers bring the virus home to their families and communities, helping drive the disproportionate and tragic impact COVID-19 has had on communities of color. This is the crisis for which Congress enacted the Occupational Safety and Health Act 50 years ago, but OSHA was missing in action during the Trump administration. It failed to take the steps necessary to require employers to protect workers from the virus. It did few inspections and it issued minuscule fines. At one meat factory, for example, where hundreds of workers were sickened and 6 died, OSHA issued a $15,000 penalty, not even a slap on the wrist for a multi-billion-dollar corporation. Fortunately, the Biden administration has committed to reinvigorating OSHA. The agency is expected to soon issue an emergency temporary standard that will require employers to assess the risks of exposure in their workplaces and take steps appropriate to each workplace to limit it. President Biden has famously promised that his administration will, quote, follow the science. To do so, as Dr. Marr has just testified, the CDC must update its guidance, acknowledge the danger of inhaling infectious particles, and advise employers to take appropriate measures. And OSHA's forthcoming standard must reflect the newest science on COVID transmission and worker protection. There is still much to be done. After thousands of cases and hundreds of deaths, workers in meat and poultry plants are still forced to work shoulder to shoulder instead of being provided improved ventilation, filtration, and adequate distancing. Many meat and poultry firms hang plastic sheeting between workers who are standing on cutting lines elbow to elbow, even though that sheeting is ineffective in stopping exposure. And astonishingly, we have seen some governors end all mask and density mandates. These ill-advised actions will likely conflict with OSHA's forthcoming regulation, which is expected to require employers whose workers come in close contact with other workers or customers or the public to mandate facial covering for all people in the workplace. The nation also needs to do more to ensure that frontline workers are prioritized for vaccination. Unfortunately, many states have no plan to do so, or they're conducting insufficient outreach to help those workers get vaccinated. Needed is a national plan for increasing vaccinations among these workers, especially those who are more difficult to reach because of language or cultural barriers or the nature of their jobs. And despite the huge impact on this nation's workers, there are few, if any, sources of complete, accurate data on the impact of the virus on workers in any industry or occupation. There's no centralized effort to compile a census of workers who've been infected or died of the disease. This is truly a lost opportunity because there are enormous lessons to be learned about preventing transmission in future pandemics. The federal government needs to make concerted efforts to collect these data. While it may be too late to conduct a census of deaths, other types of studies could be launched that would help understand the actual toll of the pandemic on the nation's workers and how to prevent future pandemics. Now, while hospitals have hailed nurses and other medical staff as heroes, these workers remain vulnerable to workplace assaults. I strongly support the Workplace Violence Prevention for Healthcare and Social Services Workers Act, HR 1195, and I'm grateful to Representative Joseph Courtney, who reintroduced the bill last month with bipartisan support. In addition, the accurate recording of workplace injuries and illnesses by employers is vital to help OSHA target the most hazardous workplaces. I strongly support HR 1180, the Accurate Workplace Injury and Illness Record Restoration Act, which Representative Mark Takano introduced to restore OSHA's ability to cite employers who systematically fail to record workplace injuries and illnesses. Thank you for this opportunity to testify. I look forward to your questions.
Thank you. Thank you. Now we'll have member questions, and I'll begin with myself, recognize myself for 5 minutes. Dr. Michaels, we heard a comment about the problem of incorporating guidance in an ETS, and if the guidance changed, the ETS changes. How complicated and confusing would that be, if at all?
Thank you for that question, Chairman Scott, and thank you for your work in this area. That's a caricature of an OSHA standard, and it's totally wrong. The key part of the emergency temporary standard, as I understand it, what we might expect to see is essentially telling employers, look, assess what's going on in your workplace, do a hazard assessment, and then look at the guidance that comes out of CDC, look at what we understand about how workplace transmission takes place, and take steps accordingly. Now, I very much agree with Mr. Rath that we don't need to be doing, major disinfection, and that really turned out not to be effective. And it's really, I believe that if CDC changes their guidance on that, employers will do much less of that. So right now, the problem is CDC guidelines are out of date, and whatever the OSHA standard is, it's going to say use that CDC standard. And when CDC standards change, workers get better protection because CDC has improved their thinking about how to protect workers.
Jim. Thank you. And Dr. Michaels, are you familiar with the Virginia ETS and now permanent standard?
I am. Virginia was the first state to issue an ETS and the first state to issue a permanent standard to protect workers from airborne infectious diseases.
And how effective is that standard, and how burdensome is it?
Well, I believe it's very effective. Look, as you've heard from Mr. Rath, some employers do the right thing without being required to, but many employers don't. And that's why Virginia issued a standard. I think it's been very effective in making sure that those employers who wouldn't normally have made those steps to protect workers are now doing so. They know they have to provide adequate distancing. They have to provide masks in workplace. And they've also given information to the Virginia government that's really important. There's a requirement to provide, to notify the Virginia State Health Department when cases are found, and when there's a cluster at a workplace, Virginia Osha is told, so they could actually go out and do some inspections.
Now, did you follow the regulatory adoption of that standard?
Yes, I did. The Virginia board, which included representatives of employers and the public, voted on it, and it was passed by a large majority.
Did that include the employer representatives?
Yes, it did.
Thank you. You were at Osha before. Can you tell us the importance of accurately recording data so that under Mr. Takano's bill, what difference does accurate recording of data, what difference does that make?
Oh, that is such an important question. OSHA requires most employers to keep track of injuries and illnesses. And that information is really important for that employer, for the workers in that workplace, because recording injuries and illnesses accurately and completely provides a roadmap to prevent future injuries from occurring. Unfortunately, we've gotten into a situation where there really is no enforceable requirement for employers to record data accurately. And the result of that is many of these OSHA logs are incomplete. And so it's hard to actually figure out the best way to prevent future injuries.
And finally, Mr. Courtney's bill on violence prevention essentially requires employers to have a plan to deal with violence. Can you tell us what those plans look like and how effective they are?
Well, again, every employer will make a different plan. That's, this idea that there's a one-size-fits-all OSHA requirement. Each employer, if it's a psychiatric hospital, it would look one way. If it's an emergency room, it would look another way, but would say, this is what we're going to do to make sure workers are protected so they can do their jobs, they can take care of their patients. That plan might say, for example, in certain situations, you can't have a worker by themselves with a patient with a known psychiatric violent problem, or every room has to have an emergency button that can be pushed to bring a security guard when necessary. So each one would be different, but each would be appropriate, and that would certainly make healthcare much more less stressful, less dangerous for the workers, and better for all of us who essentially see those healthcare professionals and need their help.
Thank you very much. My time has expired. Mr. Keller, you're recognized for 5 minutes.
Thank you. Mr. Rath, since the COVID-19 pandemic was declared and became a threat to the U.S. workplaces in early 2020, the scientific understanding of the virus has dramatically changed and continues to do so. Can you explain how the public health guidance for preventing the spread of COVID-19 in the workplace from CDC and OSHA has evolved since the early days of the virus, and how employers have responded to adopt the necessary precautions over time?
Thank you for your question, Ranking Member Keller. This is a good question. What we've seen over the past year at the employer level is that they have spent an enormous amount of energy, rightly so, trying to stay up to date with changes in our science and our healthcare understanding of COVID-19 and its transmission at the workplace. Some of those developing standards or guidances that have come from the CDC have been helpful, and they've been, at some point they were rolling out changes on multiple times a week, and employers were doing their best to keep up with those changes and contemplate and implement changes in the workplace accordingly, including the questions of what are the symptoms that were that list was rapidly developing in the early months. We saw the list expand, be bifurcated into higher and lower levels of specificity, and then be compressed into a singular list again. How long people should be quarantined or isolated if they were positive or came in close contact with a positive case. And employers have done an excellent job that I've worked with in trying to implement well-intentioned policies to keep up with that science. That science has been changing, and it continues to change. And as I mentioned earlier, just a month ago, the CDC revised its view on mask wearing to state its recommendation that 2 masks be worn, a disposable mask underneath a cloth mask. These are data-driven changes from the Centers for Disease Control, and employers have continued to very rapidly make changes in the workplace accordingly. Far more rapidly, we've seen employers make changes, and then later on, we've seen the Centers for Disease Control, or OSHA, issue guidance. For example, 2 employers I've worked with have engaged their own epidemiologists and have looked directly to scientific studies, much more rapidly bypassing the implementation of a change of policy at the Centers for Disease Control and Prevention, and far more rapidly still than guidance can be issued by OSHA. Once OSHA issues an emergency temporary standard, it has one chance to do so, and then that is immutable and intransigent against successive evolutions in science. And so that has been a success story with the employers that with whom I've worked.
So some of our employers have taken upon themselves to make sure when they've investigated and found a better way to do things, they've been ahead of OSHA and CDC in some cases.
In several instances, that's correct. They've looked directly to the scientific journalism and the scientific studies as soon as they've been published, evaluated those studies, and made changes quickly. And then you've seen those changes manifest themselves in CDC guidance, and then far later still, sometimes through OSHA guidance.
Thank you. And another question, Mr. Rath. Ranking Member Fox and I sent a letter to Acting Secretary of Labor, Al Stewart, asking the department to consider the impact that a one-size-fits-all OSHA regulation could have on small businesses. Can you explain the customary process through which OSHA solicits small business feedback related to regulatory initiatives?
That's an excellent question, Ranking Member Keller. Thank you for asking it. Under traditional rulemaking, there is a step in the rulemaking process where the agency has to solicit the input of small businesses, small business representative entities, and has to also separately evaluate the impact of a regulation on small businesses. That, in addition to scientific data cannot write a regulation. It has to be alloyed with this small business impact consideration, as well as technical and economic feasibility considerations. All rules have to go through these processes. And if you go through an emergency temporary standard, that would exclude the small business stakeholders from being able to contribute comments as to how it would impact small businesses.
So an emergency temporary standard would bypass America's small businesses, which are the backbone of our economy.
That's correct. It would go straight to developing a rule without small business input.
Thank you. And how important do you think it is to solicit the feedback from small businesses before an emergency temporary standard related to COVID-19 is contemplated?
Small businesses are a special case because they comprise the largest fraction of the workforce, and safety and health in small businesses is therefore just as important or more so than the large employers that comprise a much lesser fraction of the total workforce.
Thank you. And I just want to make the point, I worked in a factory, and my experience was that employers do value and appreciate the people that come to work every day. And for us not to consider all the America's small business, their innovators, our neighbors, the people that make our communities so great, I think would be a huge mistake by our government to discount and not hear their voice. So thank you, and I yield back.
Thank you, gentlemen's time has expired. Mr. Takano, are you there? Mr. Norcross? Ms. Jayapal?
Thank you, Mr.
Ms.
Chairman.
Jayapal, you recognize for 5 minutes.
Thank you, Mr. Chairman. Estimates from the CDC put the total number of COVID cases at over 28 million, and over 500,000 people have died. I think we have a real duty in Congress to learn what we can from the stories of people, particularly the workers that have suffered the worst of the pandemic, and to confront the stories they tell us about inequalities that are tearing our society apart. I think we have to learn what we can to turn the tide against this virus and to ensure that our country leaves future generations better prepared. Dr. Michaels, is it true that the federal government has no comprehensive system to track worker deaths or infections from COVID-19?
Representative Jayapal, unfortunately, that is correct. Essentially, the federal government leaves up to the states to even classify cases and deaths being work-related, or not even work-related, but to collect information about industry and occupation. And the states have inadequate resources and have not been able to do that. There really has been no effort made to have an overall number. To give you an example, we know that hundreds of thousands, 400,000 healthcare workers have reported to become infected, but we have actually the status that they're healthcare workers on less than 20% of all cases. So the number could be far, far higher. And while the number is important, more important is understanding why people were exposed, what happens to them after they're exposed, what happens to their communities. And while there have been some studies being done, there really aren't that many, and the feds have not stepped up to the plate to do this.
Thank you. I think it is incredibly important for all those reasons for us to have that national strategy and to do the research that you're talking about. It seems like we could start by paying attention to the COVID-19 related whistleblower complaints from workers who face retaliation when exercising their workplace health and safety rights. In your opinion, has OSHA's response to whistleblower complaints been adequate? And if not, what do you recommend that the subcommittee or Congress do about it?
Well, this is a complicated question in that, there's no question that OSHA's response has not been adequate. OSHA received thousands of complaints of whistleblowers during the last year, of workers who've complained that they've been retaliated against for raising concerns. OSHA has attempted to close some of those cases, and they've been overwhelmed. In addition to, I think, the lack of commitment of the previous administration, the whistleblower protection provisions of the OSHA law are miserably weak. And there were many hearings on this. I certainly testified in front of Congress several times. A whistleblower who is retaliated against for calling OSHA, for example, has only 30 days to apply for to complain to OSHA, and OSHA has limited ability to get them back to work. They have to go to court if the employer doesn't agree. So I think the thing we should be thinking about is how to improve the protections of workers so they can raise concerns about their health and safety or their coworkers, or and really get the protection that they need to have.
Thank you. Let me stay on this topic of whistleblowers for a second. Ms. Mohindra, thank you so much for your service on the front lines, taking care of people every day, and in such difficult circumstances. We are truly grateful to you and nurses across the country. In your experience, what does it mean for Black, Brown, and immigrant workers when whistleblower complaints don't receive an adequate response?
Congresswoman Jayapal, thank you so much for the question. There's a large percentage of Brown and Black immigrant workers who are on the front line. And so when employers do not give us the protection that we need, it is upsetting. It makes us feel like we're disposable. In addition to having the CDC and OSHA abandon us, is extremely disappointing, and it adds to the anxiety and the traumatic experience that we are already experiencing because of COVID.
And do you have statistics on the disparities that you want to put before us and enter into the record beyond what you said in your testimony?
I do not.
Thank you. I've looked at some of the data on this, and it seems to me that this is, these disparities are shameful. We have a real obligation to address them. And I think the lack of reliable data on workplace infections, because we don't have this national strategy and these things in place, the research that Dr. Michaels was talking about, it puts all workers at risk, and particularly those who are Black, brown, immigrant, who lack the other workplace protections that are really essential. So I look forward to working with all of my colleagues to ensure that the CDC and OSHA adopt the latest scientific means to stop the spread of COVID-19 at work. And I thank you, Mr. Chairman, and yield back.
Thank you. I see that the chair has returned. Madam Chair, the ranking member is the next to be recognized, Dr. Fox. So if you can recognize her, and then you'll be given the list from there on.
Thank you very much, Mr. Scott. I want to recognize the gentle lady from North Carolina, Dr. Fox.
Thank you, Madam Chairman, and thank you, Mr. Scott. Mr. Rath, if the federal government adds additional mandates on employers related to COVID-19 without considering the real world feasibility of such decrees, what impact would this have on keeping workplaces safe during the pandemic?
Thank you, Ms. Fox, for this question. It's a good question. Two things emerge to mind immediately. The first is that if an emergency temporary standard was the vehicle by which OSHA decided to regulate the subject, the science which has continued to evolve will evolve over top of that emergency standard, and it will quickly become outdated. And the agency will have little means by which to update it. Whereas by contrast, guidance documents can be updated quickly and iteratively any number of times to meet changes in our scientific understanding. The second thing I'd say is that the stakeholders have expertise. They have developed an acquired experience and learning about what works and what doesn't. And their input would yield a substantially better set of policies by the agency and at the workplace than an emergency temporary standard, which excludes and disenfranchises the expertise of employers, scientists, the healthcare community, and employee representative groups.
Thank you, Mr. Rath. Another question. Ranking Member Keller and I sent a letter to Acting Secretary of Labor Al Stewart on February 25th, inquiring about the steps the agency has taken to determine whether an OSHA emergency temporary standard is necessary to protect workers from COVID-19, and encouraging the agency to solicit feedback from businesses and workers before they made that determination. I'm a strong proponent of evidence-based policymaking. In your view, would feedback from employers and workers who've been on the front lines of keeping workplaces safe over the last year be helpful to the Labor Department in making this determination?
Thank you for that question, Representative Fox. That is an excellent question. And the answer is yes. Clearly, employees and employers have acquired a substantial amount of valuable experience and knowledge, not only as to what works in terms of interventions, but what hasn't worked and what hasn't been effective. And as well, the scientific community and the healthcare community should be provided the opportunity to comment. And that is the value of traditional rulemaking. It is a part of administrative law that we've recognized for between 80 and 90 years and shouldn't be lightly dispensed with during the pandemic.
A follow-up. What impact would new and complex regulatory requirements from OSHA, which would override the guidance issued by the CDC and state public health agencies, have on the universal adoption of basic health measures and preventing the spread of COVID-19 in the workplace?
Thank you for that question. I'll limit myself to my experience, which is strictly as an attorney representing employers in the field of occupational safety and health law. And I would suggest that employers who have carefully examined the experience that they're witnessing at the workplace have been better able to identify the kinds of interventions that work and don't work, and that their consultation with epidemiologists and healthcare members of the healthcare industry has fashioned better policies and practices at the workplaces that I've been able to collaborate with employers.
Right. Well, it's my experience that employers want very much to protect their employees. They care for their employees. In many cases, they're like families to them. And unfortunately, our friends on the other side of the aisle don't see things that way. One more follow-up. Over the last year, employers have made significant efforts and investments to adopt health and safety precautions to protect their workers and prevent the spread of COVID in the workplace. You've alluded to this, but what have been some of the most innovative measures adopted by employers, and how effective have they been in ensuring safe workplaces?
Thank you for that question, Representative Fox. We've worked with employers who, as I said before, have engaged their own epidemiologists on engagement so that they can stay up to date with current science. We've worked with employers who have rolled in temporary adjunct space so that they could have additional space for breaks. One employer has manufactured separate cooling stations so that manufacturing workers on the plant floor can take maskless breaks. I'll add to what we've discussed before. We talked to an employer who has developed their own testing capacity so that they can engage in more rapid testing on a regular basis of their work staff to keep the workforce going, healthy, safe, and the business running.
Thank you, Mr. Rath. And again, I know employers want to keep their employees safe and healthy, and that's the attitude we should have. How can we help them do better with what they know to do? But they're smart people and they'll do it. Thank you, Madam Chairman. I yield back.
Thank you very much. I want to recognize myself now for 5 minutes. Mr. Rath, let me just cut right to the heart of the issue. Do you think that COVID-19 presents a grave danger to workers? Can you give me a yes or no?
Thank you for that question, Ms. Chair. Yes, there's no question that COVID-19 presents a health and safety risk to the workforce. It is also a community risk, and employers have a substantial role in it, but not, of course, the only role in a community spread phenomenon.
Let me move on. I've got a lot of questions. Thank you. Dr. Michaels, do you think COVID-19 presents a grave danger to workers? Yes or no?
Yes.
Okay. Ms. Muhendura, what about you? Do you think COVID-19 presents a grave danger to workers? Yes or no?
Absolutely, yes.
Thank you. Dr. Marr, can you describe some of the overwhelming evidence that inhalation of virus-containing aerosols is the main route of transmission for COVID-19?
Dr. Adams, thank you for the question. Yes. The first piece of evidence is super spreading events. We've heard of these, the choir practice where 53 out of 61 attendees became sick and 2 of them died. Gym classes where 55 out of 81 people became sick, even though they were 6 feet apart. Inhalation of aerosols and shared air is the best explanation for these types of events, which can also happen in workplaces, as clearly not everyone has spent 15 minutes close to the infected person. There's also, we know, transmission by people who are infected, but who do not yet have symptoms, asymptomatic or pre-symptomatic. They're not coughing. They can transmit anyway because the virus is released in aerosols that come out when we just breathe and talk. We see substantial indoor transmission and almost no outdoor transmission. That means that's because these aerosols are rapidly diluted in outdoor air. In a study that traced over 7,000 cases of disease, there was only 1 instance of transmission that occurred outdoors. And then there have been many scientific studies where we collect virus samples or air samples in hospitals. We know the virus survives for many hours in the air. I could go on, but
thank you very much.
That would take up all our time.
Thank you. Ms. Muhendura, you testified that that you and every nurse on your unit became infected with COVID-19. Can you describe your experience?
Yes. When I tested positive for COVID, it was a terrifying experience. I was very anxious. I was lucky to have relatively mild symptoms, but my anxiety came from the fact that I had been caring for extremely sick patients that had been infected with COVID. That was always in the back of my mind, what would happen if I got that sick. I was also angry because I knew I got sick because I wasn't protected at work. And to make matters worse, it was the week of Thanksgiving and I missed my daughter's birthday because of that, because I was under quarantine. So yeah,
So OSHA refused to cite your hospital despite obvious preventable hazards that led to the death of a nurse, and their excuse was that there was no OSHA standard. Instead, they sent your hospital voluntary recommendations in a hazard alert letter that told your employer that you may voluntarily provide this area office with progress reports on your efforts to address COVID-19 hazards in your workplace. So what effect did this hazard alert letter have on improving conditions in your workplace?
Thank you so much for the question. I believe the hazard letter was sent sometime in February of this year. Fortunately, I'm part of the National Nurses United, and I feel like most of the measures that have been implemented were implemented because of the advocacy that we had been doing since last March. And I don't particularly see a lot of changes that have come out of the hazard letter.
So if your management at your hospital would have taken safety more seriously if there had been an enforceable OSHA standard, do you think that? If we had, they have taken it more seriously, you think?
Yes, I definitely think after reading the OSHA response, it was clear that OSHA could not cite my employer because OSHA doesn't have a standard. So as long as OSHA doesn't have a standard, our employers will not be held accountable for putting the employees at risk. So I definitely think an OSHA standard would enforce.
Thank you very much. Thank you for your testimony. I'm going to recognize Ms. Stefanik from New York. You're recognized, ma'am. Oh, is she not here? Mrs. Miller Meeks of Iowa, you recognized?
I'm trying to unmute. There we go.
Okay.
I was trying to unmute myself. Thank you so much, Chair Adams and Ranking Member Fox. So, I'm a physician, former nurse. So, Ms. Muhendrota, thank you very much for your activities as a nurse, also former director of the Iowa Department of Public Health. So it is new information to me that there is vast aerosolization of COVID-19, and I think that's why it's not on the CDC site. So with all due respect to the science. And in addition to which, I don't think on the CDC site, there's also recommendations for improving your immune system, such as vitamin C, vitamin D, and zinc, which I have actually started taking myself at the aspect in the beginning of the pandemic. We certainly know, and I think was asked about COVID-19 and the representing a risk to workers. And workers are not in isolation. Workers live within a community. So the only place where COVID-19 is contracted is certainly not at the workplace, which leads to my question. Dr. Michaels, yes and no question. Have you visited a meat processing facility during the pandemic?
Not during the pandemic. Previously, I have. I haven't left my house much during the pandemic.
Thank you for that. I have not been able to visit the meat processing facilities in Iowa in my congressional district or in my Senate district, but working with our public health departments, our county public health departments, and our meat processing facilities very early in the pandemic, we went through changing shift work, adding additional shifts, separating workers, putting up barriers, temperature checking on entrance, separate dining facilities, altering the rotation for when people could dine, separating utensils, not to have any reusable utensils or grabbing utensils out of a common container, and also even limiting, not putting salt and pepper shakers there so people could not contract COVID-19 through that. So it seems to me that because this is a public health issue in our communities, not just a workplace safety issue, it's hard to determine. And I have worked, in fact, with my local public health departments on testing and contact tracing, that it's difficult to determine where an individual contracted COVID-19. So, Mr. Rath, what is OSHA's current policy on recording of COVID-19 cases on employer, and on employer injury and illness logs? And what are the challenges in trying to determine where an individual contracted COVID-19?
Thank you for that question. Employers are required by OSHA to record work-related injuries and illnesses, and this includes illnesses through COVID-19. So there is a requirement to record COVID-19 cases in the injury and illness record-keeping form. There is a problem for employers, as you note, that this is a community spread phenomenon. And so employers are challenged and they struggle, even with the best of intentions. It's difficult to know which cases are contracted in the workplace and which ones come from community spread. This is a disease that is inherently idiopathic in its etiology. And the presumption of work-relatedness is certainly a starting point, but knowing that employees in their 75% of their work week are outside of the workplace makes it difficult to know which cases are work-related and which cases are non-work-related. Therefore, the data, given all the confounding factors, is of necessarily limited value, but it is important to make those record entries, nevertheless, to see if the data will yield something of any benefit.
Thank you. And again, Mr. Rath, now that vaccines are available and when we're looking at where an individual contracted COVID-19 and perhaps they're looking to their workplace for workman's compensation, if an individual refuses a vaccine, should that play into if COVID-19 was contracted and you can't prove where it was contracted from, how do you think that interplay will occur if an employee has refused or declined vaccination, especially if offered at the workplace?
Thank you for that question. The question you're asking essentially goes to the intersection between occupational safety and health law, as well as several other areas of workplace law. For example, an employee may have declined a vaccination out of a genuinely held or sincerely held religious belief, and there may be a medical opinion for that particular employee that an underlying condition which would qualify for coverage under the Americans with Disabilities Act may motivate the employee not to take a vaccination. And so employers have to find opportunities to understand whether or not they need to accommodate those particular circumstances before rendering a workplace decision on the mere fact of a declination for vaccination.
Thank you, Chair Adams. I yield back my time.
Thank you very much. The gentleman from California, Mr. Takano, you are recognized.
I'm trying to unmute myself, Madam Chair. Thank you. Thank you, Madam Chair. I'd like to hone in, Dr. Michaels, on some questioning that Chairman Scott began to ask you. Can you tell me what the Volks Rule is? What the Volks Rule was?
Yes, the Volks Rule was a regulation that we put out when I was running OSHA that essentially said that employers have to maintain a complete and accurate log for 5 years, actually 5.5 years after the injury occurred. It was in response to a court decision that said that the previous rule that OSHA had was not well written, that needed to be essentially fixed. OSHA long has had a policy that employers must keep track of injuries for 5 years. That means it's on their premises, so they can use it, workers can see it, and OSHA inspectors can see it. The Volks Rule was overturned by Congress in a Congressional Review Act, and so essentially OSHA has no ability to issue a fine against an employer if they find an injury was not on the log, if they get in 6 months after the injury occurred.
Yeah. Thank you, Mr. Volk. Thank you, Dr. Michaels. This rule also would have required them to record illnesses as well.
Absolutely.
Right? Okay. And I want to be clear, this was overturned by a Congressional Review Act in 2017 by the Republican-controlled Congress and signed by President Trump.
Yes.
That's correct?
Right.
So tell me why this rule was so important.
Well, we've seen that employers realize if they're never going to get caught by OSHA, there's no reason to record injuries and illnesses. Now, some employers always want to do the right thing and have very accurate records because they know that helps them prevent injuries and illnesses in the future. But not all employers are like that, and many take the low road and try to avoid that. In addition, we have a regulation that says that employers have to provide OSHA with summary data, and that is going to be made public. And so they don't want people to know if things are really bad at their workplace. They don't want people to know that. And so this is the opportunity essentially to lie about that. So it's really a problem.
Mr. Rath, do you agree that it's important for employers to keep records? I think you were in response to Dr. Miller-Meeks, you said it's not necessarily determinative that an illness occurred at the workplace, but it's important to have that data. You would agree with that?
Yes, and that's a good question. Thank you. There are 4 constituents that would want that data: employers who want to divine a story, a pattern from the data, employees who have a right to know, government should want to see the data, should have access to the data if it wants to see it, and researchers should also have access to that data. This is important, but the question at stake is whether or not an omission or an error from more than 180 days ago constitutes a continuing violation. It does not. It's well accepted, and that's what Congress said 40 years ago when it enacted the Osha Act, that it was a discrete moment of violation and not a continuing violation.
Well, it's still important necessarily. You would concede that it's important to keep these records. It's important. Employees have a right to know whether illnesses are occurring at a workplace. Health officials need to know whether there's a pattern for a number of reasons. Dr. Michaels, as you know, I have a legislation which I've introduced, HR 1180, the Accurate Workplace Injury and Illness Record Restoration Act, which will restore OSHA's ability to cite employers who systematically fail to record workplace injuries and illnesses. Do you think this is an important tool for OSHA to have in order to be able to provide safety for workers in the workplace?
There is no question. It is a vital tool, and that's why I'm a strong supporter of HR 1180. OSHA citations for record-keeping violations have dropped by more than 50% in recent years, and that means data is inaccurate. No one really knows what's going on in workplaces, and we can't prevent injuries and illnesses if we don't know what's going on.
Well, thank you. Very quickly, Dr. Marr, why is it that you think, do you have an opinion about why the CDC hasn't taken a firm stand on aerosol or particle transmission of COVID-19 standards?
Thank you. That's a great question. On March 5th, 2020, over a year ago, I tweeted out, "Let's talk about airborne transmission of SARS-CoV-2 and other viruses," and explained how it works. There was a reluctance, though, among the medical community to acknowledge this because I think you can't see aerosols, so they're harder to understand. There's been a long-standing bias then against transmission of viruses through the air. There's also a concern in hospitals because the word airborne has a special meaning. And then lastly, early in the pandemic, there were concerns about limited supplies of N95s. And so that drove some of the messaging.
I wish I could ask you more questions, but I yield back, Madam Chair. Thank you.
Thank you, Mr. Takano. I want to recognize the gentleman from Utah, from Virginia, I'm sorry.
Mr. Good.
Mr. Good from Virginia. You're recognized, sir.
Thank you, Madam Chair. Great to be with all of you this morning and appreciate this opportunity to talk with our witnesses. And my questions are going to be directed to Mr. Rath. Mr. Rath, with the House Oversight Committee reporting that over 13,000 regulatory guidance documents have been issued just since 2008, I would hope that we could all agree that a high threshold should be reached before we subject businesses to more regulations that are difficult and costly to comply with and that are disruptive to their essential operations. Furthermore, since the communication regarding the effectiveness of mask mandates has been inconsistent at best and even seems to contradict decades of pre-COVID lockdown studies, we should be cautious, to say the least, about continuing, let alone increasing, related regulations, restrictions, and mandates on citizens' businesses. We know that masks can help with large droplets, but there's conflicting reports regarding whether they are truly help with small aerosol droplets, such as those which transmit the viruses. And it seems that we're unable to prevent those small aerosol droplets from circulating in a normal course of life, which is needed for all of us to survive and prosper. Most of us were already practicing social distancing in the workplace and frequently washing our hands pre-COVID. And now we're even more aware, of course, of that importance with the COVID virus. and those with other health factors or working in higher risk professions need to take greater precautions. Furthermore, we have seen reports that some 70% of COVID infections actually take place among family members or those living together at home, while only 1% of infections have come from people visiting a public place such as a bar or a restaurant. So that said, Mr. Rath, are you aware of any documented cases of anyone contracting or transmitting the virus while visiting a business without a mask?
Well, that's a good question, Congressman. I have not had access in my capacity as an occupational safety and health law attorney to understand that level of data. I think that that data may be properly the sphere of public health agencies or of the employer themselves. But I will say that when employers that I've worked with look at the questions of which interventions to interpose, they look for opportunities to achieve the greatest gains in safety and health the most quickly in order to preserve the greatest number of employees' health and lives. And that has been something that every employer I've worked with has been sincerely committed to. And that's the question that they debate every day when it comes to universal adoption of masks, universal adoption of hand washing, distancing, where distancing is not possible, the installation of barriers, et cetera.
Okay. Well, thank you. And again, that your answer was that you were not aware of any case, any documented case of someone contracting or transmitting the virus while visiting a business without a mask. How about, are you aware of any documented case of anyone contracting or transmitting the virus to or from a coworker because of the failure of one or both to wear a mask?
Well, Representative, that's a very good question. And again, as an occupational safety and health attorney, I don't have the access to that kind of data. What we do work with employers on is how to make sure that that kind of transmission happens as infrequently as possible or not at all.
Are you aware of any documented case of a customer contracting or transmitting the virus to or from an employee because of a failure of one or both to wear a mask?
That's a good question. That question, the understanding of how a customer and worker might transmit the disease is inherently unknowable because of the high degree of high number of confounding factors, such as the conduct, behavior, and exposures of both parties outside of their brief interchange.
How about as we take that a little bit broader rather than going individually, can you point to any conclusive data or scientific evidence showing higher COVID virus contraction or transmission rates based on whether customers or employees were required to wear masks in general? Can we point to any data, any evidence of that?
I would not have in my role any access to that kind of data, but we do know that the employers we've worked with, without any exception, have embraced and stringently adopted a universal mask requirement in order to preserve the health of their workforce.
Well, we understand that people might embrace that or people might choose to apply that, but taking it even broader, can you point to any conclusive comparison data regarding the virus transmission rates for companies or organizations, counties within a state, states themselves, or even countries? So conclusive comparison data regarding the virus transmission rates for a company or an organization, for a county within a state, for a state itself, or a country, based on the degree of mask restrictions, mandates, or compliance.
I personally am not aware of any such data.
So each of these questions that I've asked you have been answered in the negative, that we don't have any data that we can point to, any documentation that we can point to justify mandates, regulations, restrictions being forced upon companies and organizations. And so I thank you for your answer. And I yield the balance of my time.
Thank you very much. I want to recognize Mr. Jones from New York.
Well, thank you, Madam Chair, and thank you to the witnesses for their testimony today. I am struck by some of the issues you have highlighted. As you know, New York was the epicenter of the COVID-19 pandemic last spring, and my district, which covers parts of Westchester and all of Rockland County, was hit especially hard during that extremely difficult time. Even today, Rockland County has the highest rate of COVID-19 infection of any county in the entire state of New York. Mr. Rath, I'm going to start with you. You testified about the great things some employers are doing to protect their workers, but we've heard testimony today that many other employers have been ignoring measures to protect their workers. Now, isn't it obvious that national standards would ensure more employers protect their workers?
That's a very good question, Representative Jones. Thank you for the question. The problem with a universal national standard is that, as we've already seen in the past year, science quickly evolves and rolls over a standard, making the intransigent standard unable to adopt or adapt to our newfound science or healthcare understanding of the disease.
Mr. Rath,
and for that reason, guidance is a more effective policy instrument.
Sure, Mr. Rath, but couldn't there be a rule or a standard that allows for new scientific information to be uncovered and to adapt accordingly?
That's a great question. Unfortunately, we see OSHA has issued public statements numerous times complaining that the standards that it passed in the 1970s and the 1980s have become outdated, and that the rulemaking process to revise that is not only time consuming and resource consuming, but it won't be implemented quickly enough to make the difference that employers can make and that agencies like CDC and OSHA can make through guidance implementation.
For claiming my time. Thank you so much. You said in your testimony that an emergency temporary standard is not a suitable vehicle for government intervention in the pandemic, and that employers will prevail against the spread of coronavirus. But respectfully, sir, I think we see how this thoughts and prayers approach plays out in, for example, the gun violence context, where the government literally does nothing to address that epidemic. Thankfully, by the way, today, House Democrats are doing something about gun violence. But also, your approach to addressing COVID-19 in the workplace is in line with the previous administration's position. The Trump administration downplayed the danger COVID-19 posed to workers and the general public. The administration even failed to protect its own staff. We know that from September to January, as many as 48 White House staff and associates tested positive for coronavirus, including top officials in the president's inner circle. All of this while the president told Americans to drink bleach. So today marks 1 year since the World Health Organization declared a global pandemic. Nearly 550,000 people have died in this country since then, many of them essential workers on the front lines and their family members. Unfortunately, we don't know how many of those who died contracted COVID-19 in the workplace. I'll grant you that. But as we heard in this hearing, there have been outbreaks in workplaces across many industries and workplaces like at JBS and Smithfield Foods meatpacking facilities. And we've seen companies take retaliatory actions against workers who raise safety concerns around COVID-19. In my home state of New York, we saw an incident in which an employee at an Amazon fulfillment center was fired for demanding better protections. That's the previous administration's record on workplace safety in the pandemic. And most Americans understand we need that to change. We need OSHA to issue an enforceable standard to ensure people can be safe at work, because the problem, sir, with voluntary guidelines is that there are too few volunteers. And so with my time remaining, I'll ask Ms. Mohindra, my district has around 20,000 nurses, many of whom have had to deal with the trauma of the COVID-19 pandemic, as you have described it. Can you briefly tell me about the nurses you work with? Who are these people?
Yes, Congressman Jones, thank you so much for the question. I work in a level 1 trauma, which is we see the highest traumas around the Kansas City area. And I have the privilege of working with some of the most amazing nurses that I have ever met. Some of the strongest people I've ever met, physically and emotionally. But we have all been affected by this. We're taking care of these patients because it's taken a tremendous toll on us.
Thank you. You all deserve recognition for your incredible work on the front lines. And Madam Chair, I yield back.
Madam Chair, I believe I'm next up in the line. Do you mind if I go ahead and start?
Dr. Adams, I believe you're muted.
Um, Am I unmuted now?
Yes, ma'am.
Okay, I apologize. I'm having some technical difficulties. Mr. Hawthorne, go ahead. You're recognized, sir. Cawthorne.
Thank you very much, ma'am. To all of the witnesses, I genuinely appreciate all of you coming on. Mr. Rath, I really thank you for everything that you've done. And also, my life has been saved more times by nurses than it has by doctors. So I genuinely appreciate all the nurses that are on that you're representing. But Mr. Rath, I've got a question for you. In your testimony, you state that if OSHA had adopted strict standards on any of these issues in an emergency temporary standard a year ago, that these requirements would have quickly become antiquated by science, dismissed by the public, and then it would have discredited the agency, as you said. So that's the end of the quote. But we've heard a lot about science regarding preventing COVID-19's transmission. Chairwoman Adams had an eloquent opening statement when she said we cannot properly respond to this pandemic unless we truly understand all of the data. And so I'm wondering, in your view, what is the appropriate role of science in informing regulatory policy? More specifically, how do statutes such as the Administrative Procedure Act, which governs the procedure for the process by which federal agencies develop and issue regulations, allow for related input when regulations are proposed? As we know, science changes very often.
Thank you for that question, Representative Cawthorn. The process of developing a rule at OSHA should start with sound data and the best available evidence, but that is merely the starting point. All OSHA regulations have to start with the best available evidence and be alloyed with traditional rulemaking principles such as technical feasibility, economic feasibility, the impact on small businesses, consideration of flexible options in rulemaking, and then finally the experience and acquired wisdom of the stakeholder community, employee representatives, employers, the scientific community, and the healthcare community, all can play a part in hammering out a better and more workable and more effective standard at the end of the process that starts with science.
Mr. Rath, thank you for that answer. But it's still, just move to get a little more detailed. Is there a way that OSHA can utilize the information that's on the ground? I always, the reason why I love the state government so much more than the federal government is because it's closer to where the actual information is. I believe in the information, and the decisions are coming from where the information lies. I think that it works better for every single industry that OSHA touches. Is that something that's possible to have OSHA receiving that input, and the new scientific guidelines, and then to be flexible with it?
Yes, there's no question that OSHA has used guidances over the past year and issued a number of helpful statements for the employer community that have adopted the evolving science, and they've referred specifically to the Centers for Disease Control and Prevention guidance, which has been even more frequently updated. And by that method, employers have looked to the CDC's guidance to figure out what the best practices in their unique workplaces should be.
Fantastic. Well, Mr. Rath, thank you very much. And all the witnesses, I do appreciate it. And with that, Madam Chairman, I yield back.
Thank you very much. I want to recognize Ms. Stevens from Michigan. You're recognized for 5 minutes, ma'am.
Thank you, Madam Chair, and thank you to our witnesses for this critical hearing, and part of why I'm so delighted to be on this subcommittee under the great leadership of Chair Adams. You might have seen last year, actually almost a year ago, it might have been 53 weeks ago, 53 or 54 weeks ago. I did a letter to the agencies asking for an interagency task force to report the real-time scientific guidelines as we were getting them, right, with a novel virus to be communicated through the Secretary of HHS, the communications to our employers and employees, right? A year ago this week, I'm with my chief of staff. This is the last time we were all fully in the office. And I said, I got to call the grocery stores because all of a sudden they're an essential workplace. They're like our general stores. Do they have what they need? So this commending the work around the enforceable standards, an interagency approach, part of what today's hearing is doing is not only coming up with strategies to protect essential workers from COVID-19, but it's also helping us think through what we do the next time a novel coronavirus hits. So, Dr. Marr, we've seen, some states recently lift their mask requirements, all right? And last week, the Retail Industry Leaders Association, they released a press statement opposing the lifting of mask mandates, stating that relaxing common sense, non-intrusive safety protocols like wearing masks is a mistake. We see some friction with the private sector in some of these states that are lifting the mask mandates a little bit prematurely. But can you, Dr. Marr, just for the record, can you share who's going to be most impacted by the removal of these requirements at this stage that we're at in the pandemic, if you don't mind, please?
Absolutely. There is no question that mask mandates work or universal masking works. This has been shown in many scientific studies. It's hard to point to individual cases, but we can analyze population level data and showing that there is a decrease in the rate of number of cases with greater masking. The real victims of lifting of these mandates are the people who are going to contract COVID-19, some of whom will die. And because of the lifting of this, we're gonna have more cases and more deaths than we would otherwise. Besides bringing tragedy to the families of those who die, this also places an additional burden on our already exhausted healthcare workers.
Right. Yeah. And so this, would you say this has an effect on the safety of workers who are in frequent contact with the public for 8 or more hours a day? I just recently had a grocery store worker share with me, they're in contact with somewhere between 500 and 1,000 customers on a daily basis. But do you have any more information on the safety of workers who are in contact with the public for 8 or more hours a day?
Sure. These individual interactions are brief in time, so they may not fall under the 15-minute rule for contact tracing, but they add up. And so over that 8 to 12-hour workday, the grocery store worker can be in contact, and we know with aerosols, you don't need to be close to that person. So masks are effective as source control, reducing the amount of virus that people release into the air. Yeah, they may not know that they're sick. If people are not wearing masks, that could happen and workers could be exposed. I'm worried about the workers who will now be exposed to much greater amounts of virus in the air than before if the mask mandate is lifted.
Right. Because it's with our droplets. Okay. So noted for the record. And Dr. Michaels, we were hearing from Mr. Rath, his testimony casting doubt on whether the Osha ETS would reduce the number of work-related illnesses and deaths. I know we've kind of been covering this in this testimony here in this hearing, and all of you are fabulous, by the way. Pascaline, you're just shining today. We're glad to have you and your fabulous background here as well. But Dr. Michaels, do you think that an ETS would have a benefit of reducing infections during the 180-day efficacy period? Can we just say it again for the record?
Of course, this idea of going through the long OSHA administrative procedure makes no sense in an emergency. We need to do this now. We need to do it, 6 months ago, but it will clearly make a difference because while not all employers are as exemplary as Mr. Rath's clients, it will impact millions of employers and reduce exposure to many millions of workers and will save lives.
Thank you. And I yield back, Madam Chair.
Thank you very much. Is Ms. Steele of California, the young lady from California, you're recognized.
Thank you, Chairwoman Adams, and all the witnesses today. Independently owned small businesses, including retail and restaurants, are the backbone of our local communities. There are more than 22,000 small employer businesses in Orange County in California. These businesses employ more than 183,000 people and generate almost $10 billion in payroll for our community. These business owners and employees are working hard to prevent the spread of COVID-19 and trying their best to keep their employees safe and employed. But prolonged lockdowns have led to almost 50% of small businesses throughout the state of California at risk of closing or never reopening. We need to work in collaboration with local businesses and hear their stories, not rush to implement one-size-fits-all OSHA regulations that could halt the safe reopenings that are already in process. We need to empower our communities and help these businesses thrive while also keeping customers and employees safe. That is why I have worked on the Fresh Air for Business Act to empower businesses to modernize their ventilation systems in order to reduce the transmission of airborne diseases, including COVID-19. Having said that, Mr. Rath, thank you very much for coming out today. You mentioned how businesses in Southern California were impacted when OSHA hastily approved an emergency plan where stakeholders were prevented from wading in and making the standard more workable or effective. We have both seen how local California business owners have been affected by OSHA compliance. So should the federal government rush misguided actions to could have long-lasting unintended consequences for employers and employees just rush burdensome standards?
Thank you for that question, Representative Steele. Had California taken into account the feedback from the stakeholder community, employees and employers, they would have avoided unnecessary mistakes. For example, the California Emergency Temporary Standard imposes upon employers the duties that are traditionally associated with public health agencies, like contact tracing, continuous testing, and paid leave, housing, transportation. These kinds of mistakes could have been avoided. And since then, the California OSHA has issued 3 revisions to its frequently asked questions, several press releases, fact sheets to try and clarify ambiguities or statements that they had made in their original emergency temporary standard that they quickly came to regret as having been poorly thought out.
So in your opinion, what government has to do when we have some emergency situations such as COVID-19?
Well, I think it's important to solicit the input from those with real experience, employee groups, employees, employee representative groups, like the ones that Ms. Mahindra is a member of, the scientific community like Dr. Marr, and of course, the agencies have a particular role to play as well. But collectively, that input will fashion a better set of policies than an agency unilaterally driving policy by itself.
So you think that it's going to be really helpful that you prepare for this kind of pandemic, hopefully not in the future, but prepare those professional people just group together and just get ready for next pandemic or COVID-19, something like that coming?
I think that there has been a tremendous amount of experience and knowledge and wisdom acquired in the workplace community that can contribute to being better prepared for the next pandemic should one ever develop.
So I really appreciate it. Madam Chair, I yield back.
Thank you very much. I think if all committee members have asked their questions, I believe they have. I want to now recognize Mr. Courtney of Connecticut.
Thank you, Chairwoman Adams, and thank you for, again, bringing HR 1195 on today's agenda. Again, as Dr. Michaels indicated, this is the bill that we passed in the House last year by a rather healthy bipartisan majority, 251 votes in favor. Again, that dealt with what was then described as an epidemic by the CEO of the Mayo Clinic, namely workplace violence for healthcare workers and social workers. Just a month ago, we had another terrible, tragic incident that took place in Buffalo, Minnesota, where a disgruntled patient showed up at Alliance Health Clinic, shot dead. One of the healthcare employees and 3 others were critically injured. Again, with no sort of early warning systems or measures in place, which OSHA has developed as voluntary guidelines for many, many years. But again, because we don't have a national standard, are just not being implemented. Ms. Mohindra, again, thank you for your testimony today. Again, your organization has been a staunch advocate for workplace violence protections. And I was wondering if you could take a moment to talk about this other epidemic that, again, people who are going to work every day in the caring professions face.
Yes, thank you so much, Congressman Courtney, for the question. As nurses, we face workplace violence for many years. Luckily, I'm part of a union that has fought very hard for the nurses, and we have gained a lot of protection simply because of the advocacy that we can do through our union. We have such things as panic buttons in our hospitals where we can push if we have a violent intruder or just a patient that becomes violent suddenly, and security is able to respond quickly. But unfortunately, not everyone has these protections throughout the country. I used to work for a hospital that was not part of a union, and they had no such protections. And to add to that, it feels like violence has gotten worse in the past year. We've seen an increase in anxiety and agitation in patients with COVID related to the strict isolation. So I feel like we could definitely use more protection.
Thank you for that, because again, there is some narrative, well, because patient volume may have gone down because of elective procedures, that, the workplace violence issue has diminished. But in fact, we've seen surveys that unfortunately it continues unabated, just like the incident that I just mentioned. Dr. Michaels, last year or 2 years ago when we debated this bill, we were assured, and I think in good faith by opponents of the bill, that the Trump administration was moving forward with a rulemaking process. And unfortunately, every single initial hearing was postponed 4 consecutive times. We are absolutely at ground zero in terms of any movement within the agency. Again, Mr. Rath, to his credit, did note that OSHA moves slowly. And unfortunately, we're talking about life or death issues in terms of protecting people in healthcare institutions and social work. Again, I wonder if you could just sort of talk about that, about whether, given the gravity of this issue of workplace violence, as well as the pandemic, whether or not, we can just rely on the normal rulemaking process to do anything in a remotely timely fashion.
Oh, these are exactly the right points, Representative Courtney. OSHA takes 10 years or more to issue a standard. One of the last things I did when I was running OSHA was accept a petition from the National Nurses United and from other unions, telling OSHA, asking OSHA to move forward on this because the problem was so severe. The stories we heard were heartbreaking. We cried at meetings when you heard what happened to healthcare workers and social service workers. But without Congress setting a deadline, it will take at least 10 years for OSHA to get this thing out. That's the normal route. I mean, we've already lost years and years because really nothing happened during the Trump administration. They said it was going to move forward, but it didn't. So for your bill, which gives OSHA 42 months to get it done, would be a huge step forward and really make a difference. It would make the lives better of nurses and others who provide this important work, but also would make healthcare and social services better because people can't work if they're under threat of assault. Everybody I talk to who works in an emergency room says, yeah, it impacts you when you're always looking around to make sure no one's going to hit you. I mean, this is just simple common sense. An OSHA standard would not be one size fits all. It would say, figure out how to address the problem in your community, in your workplace. And that's what we really badly need.
Thank you. And thank you to all the witnesses. I yield back.
Thank you, Mr. Courtney. I want to remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing. So by the end of business, the close of business on March 25th, 2021, preferably in Microsoft Word format. The materials submitted must address the subject matter of the hearing. Only a member of the subcommittee or an invited witness may submit materials for inclusion in the hearing record. Documents are limited to 50 pages each, and documents no longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame, but please recognize that in the future, that link may no longer work. Pursuant to House rules and regulations, items for the record should be submitted to the clerk electronically by emailing submissions to ed.labor.hearings@mail.house.gov. Member offices are encouraged to submit materials to the inbox before the hearing or during the hearing at the time the member makes the request. Now, I want to again thank the witnesses for their participation today. Members of the subcommittee may have some additional questions for you, and we ask the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. I want to recognize now the distinguished ranking member for his closing statement.
Thank you, Madam Chair. I ask unanimous consent to place into the record a statement from the American Hospital Association and letters from the Construction Industry Safety Coalition and the National Retail Federation raising concerns with a potential OSHA emergency temporary standard on COVID-19.
So,
thank you. The American economy is diverse, and it would be naive for us to believe that broad mandates handed down from Washington, D.C. could ever accurately represent every workplace throughout the country. If we want to have a conversation about that, about what is best for our businesses and workers, then it only makes sense for them to be brought into the fold as part of the discussion. I suspect the last thing Main Street America needs right now is more bureaucratic red tape and barriers dictating how to properly keep their workplaces and teams safe. I appreciate the majority calling this hearing and look forward to engaging with my colleagues on the other side of the aisle about how we can work together on smart policies that properly consider the realities of America's workplaces. Thank you, and I yield back.
thank you very much. I now recognize myself for the purpose of making my closing statement. What we heard today is that our nation's workers need and deserve updated CDC guidance and a strong OSHA emergency temporary standard that reflect the best science. This committee has flagged the importance of considering airborne transmission of the virus in a March 1, 2021 letter to the administration. I ask unanimous consent to enter the letter into the record. So ordered. We have only recently emerged from a year of national crisis where OSHA, the only federal agency with the authority to enforce safe working conditions, left workers on their own. This was not just disappointing, this was a tragedy for tens of thousands of workers in this country and their families who were infected by COVID-19 and the thousands who died of preventable deaths because they lacked adequate protections on the job. Swift action to protect workers is exactly how the architects of the Occupational Safety and Health Act envision OSHA's response during a workplace crisis. The acts tell OSHA that it shall issue an emergency temporary standard if it determines workers are exposed to a grave danger or from new hazards, and that a standard is necessary to protect workers from that hazard. Now, I think it's clear that COVID-19 meets these two legal preconditions. We welcome the Biden administration's clearly stated intention to act on that emergency authority. We also urge the administration to focus its efforts on a national strategy to ensure that vaccination of essential workers is prioritized, not only in principle, but that every effort is made to ensure that needles enter their arms as soon as possible. Furthermore, in order to learn the lessons of this pandemic and ensure the safety of workers in the next pandemic, all relevant agencies of the federal government need to put their heads together to develop a way to quantify the impact of COVID-19 on this nation's workforce. And finally, OSHA cannot effectively carry out its mission without resources. The number of inspectors is recovering from a record low. The number of safety and health complaints has piled up. and the backlog of whistleblower claims is daunting. The American Rescue Plan Act, H.R. 1319, passed by Congress yesterday, sent to President Biden for his signature, provides $200 million to the Department of Labor for worker protection activities related to COVID-19. Not less than half that amount, $100 million, is directed to Osha to meet this moment. I'd like to thank all of my colleagues in the House and the Senate for making that happen. And I want to thank the witnesses again for their testimony. If there's no further business, without objection, the subcommittee stands adjourned.